welcome to another episode of When Life Was Messy. I'm one of your wonderful hosts, Ashley Barrera,
And I am your other wonderful host, Erin Raspberry.
and welcome to our second episode of our eating disorder series with the lovely Ramiro Saavedra.
Yes. Big shout out, heart sign to Ramiro.
Yes.
We are very thankful again for him joining us and doing this three-part series with us. And this episode was really good. I feel like we learned so much in the first episode with him. But then I'm like, man, like this whole series has just been so informative and I appreciate all his wisdom. But in this episode, listener, so this is the second one of our series, so we dug in a little bit more on what it looks like in terms of signs and symptoms to notice, to kind of know when we need to seek help. Also looking at like why early intervention is important. And then also like how do we go about like even getting diagnosed with an eating disorder, and what that process looks like. He also shared a lot of great information on different types of treatment, different types of level of care, which I think too for someone that might be obviously like struggling with an eating disorder or in general, I think it's just really nice to know like what that process looks like and what different levels of care and options are out there, just to kind of have like a little bit more clarity and hopefully ease some of any anxiety that you might have about pursuing care in any way. So he does a really good job of talking about that. And then also kind of gives us an idea of differentiations between what a general dietitian does and what someone that has more specialized care with eating disorders looks like. And there actually is like really good reasons of why to pursue someone that has specialized approach to it. And also just kind of like what does it look like to kind of take a healing standpoint from the nutritional aspect in
Mhm.
recovery. And then lastly, to kind of like wrap it up, he kind of talked about like what does it look like for someone that might be a loved one, of someone that has an eating disorder or struggling with disordered eating, and how to go about kind of showing that support and love. Because I think it's just one of those things too that a lot of people are like, hands up in the air, I don't know what to do here.
Mhm.
So that was really helpful information. And also just ways like people in like everyday life, even if you do not have like a full-on eating disorder, but maybe need to be more intentional about shifting your relationship with food and ways to do that. And then also red flags to be kind of aware of. So it was a really good episode.
Yes. Really good.
Mm.
And looking forward to the third one, where we also are going over some questions from our listeners.
Yes, so please
Yeah.
send in your questions.
Yeah. So thank you for listening, and we hope you enjoy this episode.
Well, thank you so much, Ramira, for being back. This is our second episode of this series. So if you haven't listened to the first episode, please go and listen to that one because this is a continuation of that topic. But Ramira, for our listeners, will you just give again a brief introduction of yourself?
Yes, my name is Ramiro Saavedra. I'm a registered dietitian by background. I am faculty here at Texas Women's University, Houston, where I teach a course on eating disorders, and I work in our dietetic internship program. I am also with Houston Methodist Hospital as a clinical manager for their outpatient weight loss and bariatric center.
Nice. He is a very busy man, and we are so thankful that he is joining us again. But we are just going to dive on into this. Again, this is a continuation of the last episode. So we're going to start this episode, Ramiro, with really focusing on when to seek help and kind of noticing like what are the signs, maybe physically, emotionally, that someone should kind of be aware of so that they know when to seek support for their relationship with food, body image, all the things.
Right, right. Okay, well, when we look at, what the signs are, when we look at signs, either physical or emotional, things that people should seek support for the relationship with food. First and foremost, I always tell patients that when their thoughts and their life starts revolving around food,
Mm,
we may be a little too late at that point. Um, Catching it early is really important. And what that looks like is a lot of rumination about food and intake.
mhm,
Because everybody thinks about what they're going to eat. Some people, plan out their meals, and there's nothing wrong with it. There's no pathology behind that, so to speak, right? But when you begin to think about food as reward and punishment, when you
mhm,
begin to start obsessing about every single calorie or every single ingredient in a label, when you begin to cut out complete food groups,
mm,
when there's no rationale to a behavior other than health, right? So
mm,
health might be a reason why people change their diet, and that's completely acceptable. But when you start changing it and you don't necessarily have a goal in mind, right? A lot of athletes change their diets and then they can change it very drastically, but there's a goal end in mind, right?
mhm,
And when there's no goal end in mind, when you catch yourself attaching feelings to food, whenever there is a lot of rumination about what you should be eating and should not be eating, and when all of that plays a role or comes back to your self-worth, that is when I think
mm,
you should, begin to think and ask the question is, do I have an altered relationship with food, right?
mhm,
And so one of the things that we see is that, it's not just about food, it's also about body image.
right.
When we look at the research on how disordered eating starts in people, we know that in, cisgendered males, at least because that's what the research has, that's where the data is,
Mhm,
unfortunately, we know that it starts with body image
mm,
in them versus with women, it may start with preoccupation with thinness or idealization of a thinness ideal. With men, it often starts with the idea of body image and wanting size, leanness, muscularity, right?
mhm,
So it may look different in different people, right? And when we take a look at that, body image is another really big piece of how people can over monitor that, right?
mhm,
Their specific shape. People seem to think that they can work out and lose weight in a specific part of their body, but that's just not how weight loss works. That's
mhm,
something we teach people in our classes at my job. We talk to them about, having a healthy body image and just accepting where they are and that being okay. Um,
mhm.
but there's a lot of people that will monitor their body constantly, that will constantly compare what they were, in high school to where they are now. And
Yes.
the truth is, you were an adolescent in high school and even in college, you're an adolescent,
Mhm,
technically
Mhm.
speaking. And
yes.
you may not get back to that body type or shape, and that's okay.
Mhm,
People's bodies change throughout their lives, and body image distortion is one of those things that is another thing that if you find yourself doing those things constantly, body checking, weighing constantly, and again, the important piece is that becomes attached to your self-worth. That's when I think
mhm,
people should maybe worry and seek some help and ask some questions.
mhm.
There may not be anything to worry about, but we don't know unless we ask.
Right. Oh, I'm so glad you said that about comparing your body to high school and even like maybe undergrad, like younger college, because I hear that so much in clients and students that it's like, well, I'm not as like skinny as I used to be. I was a size 2 in high school. And it's like, you're not, your body has changed so much
Hmm.
since high school and that's okay. That's supposed to happen. But it's just like, there's like a block there of,
Hmm.
unless I'm like back to that, which maybe was my prime, putting that in quotations, then I'm not good enough or I'm not doing enough.
Hmm.
And it's like, wow, so many people that I really hope listen to this episode and needed to hear that. So thank you for saying that. What do you think like really stops people maybe from reaching out and like how do we kind of help break through that hesitation?
Yeah, so I think there's two things. The first thing is that because of society, and it's always been there, it just looks different now because of social media. But
Mm,
one of the things is that society has normalized talking about yourself in this way. We've
Mm.
normalized like the over-policing of our bodies. We've normalized this idea of healthy eating going to an extreme and it's still being healthy eating. And I'm going to put that in quotes, right?
Yeah.
So society, in a sense, has normalized that. So a lot of people may be walking around with a diagnosable eating disorder or walking around with some disordered eating, in their day-to-day habits, but they don't know it because they're looking at what's going on in social media and see that everybody's doing this, right? Back in the day, people would flip through the magazines and, the television ads and see that, oh, well, everybody on TV looks this way or everybody in the pictures looks this way. And so there's this normalization that a lot of people may not be aware is not what everybody looks like. That's just what a small percentage of people look like. And that may be attainable for you, but for most people, it's not, right?
Right.
So there's that piece that keeps people from coming forward is just not the lack of awareness that perhaps some of those things that they're working towards or thoughts that they're having may not be realistic, right? The other thing that keeps people coming forward is a lot of shame and guilt because, again, a lot of what they do with, disordered eating comes back to self-worth and then to self-image and people's construct of themselves. And one of the things that, people don't want to come forward about is that they have to admit they have a problem, just like with substance abuse, right?
Right.
But two, they have to want to seek the help, right? And a lot of times we see this a lot in clinical treatment, people don't want to get help sometimes because they find that when they have the disorder and the disorder is active and it's not in remission, they get a lot of attention, right? They receive a lot of care. They get things that they're probably missing in other aspects of their life. When we look at teenagers, right, a lot of teenagers will self-sabotage their own treatment because it's the one time that the whole family comes together to be for them, right? And that keeps the family, quote unquote, together. If there's some familial things or family dynamics that are not going well. But there's a lot of shame attached to it because there's a lot of people that, still see eating disorders in a very negative light. And instead of seeing the hope that lies behind the treatment. And then for some populations, there's a lot of guilt because they blame themselves as a result of it. And then also, just with populations like with men, they're just not going to come forward about it. They already don't want to come to just regular therapy,
Right.
let alone
Right.
coming to, therapy to deal with something as sensitive as eating disorders and body dysmorphia and things like that, especially because when they talk amongst themselves, there is a lot of chatter amongst men about disordered eating, but it's almost played off like a joke. If you hear it online or you hear even professional athletes talk about it, there's people that will record themselves and say, and they're, what I eat in a day or like how I exercise in a day. And then they're like, yeah, the body dysmorphia hit me, so I had to do 2 more sets. And they'll say things jokingly, right, and in passing. But how much of that is true, right?
Right.
And a lot of people don't really want to come forward about it for those reasons.
Yeah.
I think it takes us as a society normalizing, just like anything else, saying that it's okay for you to come forward. It's okay to not be okay. And to be able to accept the help that's there for you.
Yes. Oh my gosh. Yes. Also, so interesting when you were talking about like how it's almost like jokeified, if that's a word. Like, I think that is, I don't think I thought about it that way, but it's so true. Like, I think it almost is like portrayed as like, oh, if you kind of like have this part of it, then it kind of makes you like cooler in a way to be in that spot. And it's like, actually, that's pretty distorted. Like, what's the impact of that right now? And now I'm like, I'm gonna like overanalyze like everything that I hear and watch now. But I know you kind of talked about this earlier, but maybe just to kind of put a little spotlight on it again. But from your perspective, why is early intervention so important for this?
Great question. So early intervention is important because if we don't catch it early, this can be a lifelong disease for somebody.
Mm-hmm.
I have treated patients as young as 12 and as old as 72, 74.
Wow.
People that were struggling with this, for all their lives, particularly my older clients, tend to have gotten help much later, like in their 30s and 40s. Why? Because it came up during a bone scan that early on, they were already having signs of bone mineral density loss as a result of their eating disorder, or other things were happening, right? They're trying to get pregnant and they couldn't, and things like that.
Right.
And all that's affected by an eating disorder that's out of control. The earlier you can intervene, the better the treatment may go, and the more open someone is, as well as changing their frame of thinking about things. If you can intervene early in that, then even if the eating disorder is, prevails or is persistent, at least they are aware and they can start, taking measures into thinking about things differently. But catching it early is really important. And so that's one of the things we stress with clinicians is catch it early. If you're not sure, there are lots of screening tools. I know we'll talk about that in a second. There's a lot of screening tools that anybody can use. You don't have to be licensed or specializing in eating disorder to screen your patients when you're seeing them, whether you're a nurse, a doctor, a dietitian, mental health therapist, any of those disciplines can screen and at the very least refer.
On that note of catching it early and like getting help, what would you say are some things that like the average person can notice in themselves or a loved one that could help them start asking for help? Like if they don't know that they have an issue, what can they be on the lookout for?
Right. One of the things that they can be on the lookout for is any behavior that is categorized as binging or purging.
Okay.
So behaviors that restrict intake for no reason, really, there's no health reason why you're restricting to very low amounts of calories. So anything under 1,200 calories. If they catch themselves, in a lot of ways, trying to restrict their intake, not just throughout the day, but restricting specific food groups or completely eliminating them altogether, engaging in purging. And purging can look like lots of ways. So the classic purging that we see on TV and movies is self-induced vomiting. But it can also be laxative use. So, abusing laxatives and diuretics. And also abusing other drugs. There are a lot of type 1 diabetics that suffer from eating disorders, and what they'll do is they'll purposely not take their insulin because that leads to weight loss. Right?
Oh,
so one of the
wow.
things that happens with diabetes when you kind of on the precipice of ketoacidosis and not is extreme weight loss. And so it can show up in many different ways, but those are some behaviors and things to be aware of. A couple of other things too is just constant rumination about food. Food should be something we think about or like, oh, I want to eat this and done, right? But when it becomes your whole life and that's all you think about and it's all you talk about, that might be something that, causes people to worry. And then anytime that you're body checking constantly yourself or asking others about your body, things like that. It's okay to ask somebody, hey, how do I look in this? Or, how am I, what do you think of this? But if it's constant body checking that leads to negative conversation about yourself, there might be something to explore there.
Can someone still benefit from treatment even if they don't have a formal diagnosis?
Yes, and we talk about this all the time because people's relationship with food changes, right? When you're a child, you have a different relationship with food. You're eating more intuitively. You're being fed what your parents are eating. When you become an adolescent, you have more autonomy. You are choosing foods for yourself. You're choosing a lot of the things that you're eating on your own. There's a lot of more freedom. And then when you become an adult, you're already engaging in what we say your adult behaviors or your forever behaviors in food. And so, even if you don't have a diagnosable eating disorder, if there is some form of disordered eating, there's benefit in seeking treatment either from a licensed counselor or working with a registered dietitian to be able to achieve some normalcy in that and find some freedom from it. Because everyone should be able to eat, everyone should be able to look at themselves in the mirror, and everyone should be able to think positively about themselves without it being attached to what you eat and the morality that comes with that.
Okay. So you mentioned just now, like, reaching out to a professional, like a licensed therapist or a dietitian. What other parts of the process is there for someone that's wanting to get help?
Yeah, so the first thing is, the screening process. There are about 3 or 4 different questionnaires that are validated and reliable tools that are used by healthcare providers to screen. So typically, you can get screened by anybody, as I previously mentioned. But when we look at diagnostic criteria specifically, we use the criteria in the DSM, the Diagnostic and Statistical Manual of Mental Disorders. And what it does is it divides each eating disorder into, its own set of criteria. And a lot of the behavior, so it's diagnosed behaviorally, and it divides those behaviors by how frequent they happen, and then how often you're engaging them in a specific frame of time. It also incorporates some biological things that could be happening as a result of the disorder, and each one has its own criteria. Now, who makes the call? Well, it would depend on who you go to. In the state of Texas specifically, you can go to several people to get, screened and essentially diagnosed. Registered dietitians, registered nurses, other allied health professionals are not qualified to diagnose. Although we can treat, we are not qualified to diagnose. Who really can diagnose are doctors. So you can see your primary care, your OB-GYN, they can diagnose, but oftentimes they'll refer out to a psychiatrist. And so a psychiatrist is different from a psychologist. Now, I just want to clarify for our viewers.
Yes, thank you.
Psychiatrist is a medical doctor. They went to medical school and then they did 3 years of residency in psychiatry. And they can treat a plethora of things from just general, behavior issues of day-to-day life, or what we would say counseling, psychology type things, to clinical, quote unquote, abnormal psychology, all the way to borderline personality disorder and antisocial personality disorder and more severe things. So they can treat a huge spectrum, but a psychiatrist has the ability to prescribe medicine. And that's the main difference. They can diagnose the eating disorder, but they can also prescribe medicine if it's appropriate for that eating disorder. The other professionals that you can seek help from are any licensed therapist. And that is a big umbrella of people, because there's lots of people in the state of Texas that are allowed to provide therapy. So one would be a licensed psychologist, a licensed clinical social worker, a licensed professional counselor, and technically a licensed marriage family therapist could diagnose, but they usually don't. They don't work well. They don't work with individuals as much as they work with couples. But anybody who has a license to diagnose in the state of Texas technically can. And so the majority of people we see diagnosing this are either psychologists, LCSWs, or LPCs. And those individuals can not only diagnose, but can also treat if they're comfortable with that.
And it also sounds like with those different providers that you listed, like there's different levels of care that someone might encounter. So what would you say is like the typical that you see?
Yeah, so with a psychiatrist, the level of care there is they're probably monitoring your labs. They're looking at physical signs and symptoms. They're going to be screening for if the eating disorder has reached other parts of your body, right? And they'll be prescribing medicine. And that's kind of the level of care they're engaged in. The therapist is going to perform screening tools and assessments. And for example, some practices, everybody does it differently, will have the patient meet and be assessed initially by a licensed psychologist. And then once a treatment plan is developed involving psychotherapy or family therapy or whatever it be, then they're handed off to an LPC, an LPA, or an LCSW that can actually provide the therapy, have the longer sessions, and follow that treatment plan. And so there are different levels of care. When we look at also levels of care, it's specifically in eating disorders. The first level is outpatient. So you go home, you live your life normally. You come to therapy with your therapist, you see your doctor, your psychiatrist, and then you meet with a dietitian. And that's done in an outpatient basis. So it could start off weekly and then taper off depending on how your progress is. Now, if your level of acuity, and that's decided by your treatment team, if they feel like this is a little bit more intense, they may recommend intensive outpatient therapy, which is more involved. You may come to an outpatient facility for a specific amount of time, 2-3 hours in the day, and you participate in various activities. So you meet with all your care team individually. You may go to group therapy. You may do other things, support group, and then you get to go home. And then there is inpatient hospitalization. And what that is usually reserved for is very severe cases where there is a lot of medical issues going on. So there is severe malnutrition. There's a risk of refeeding syndrome. So when somebody has been starving for a while and then we start to reintroduce food, their body can then begin to absorb too much too quickly because it's been in that starvation phase. And that can increase levels of electrolytes dangerously very quickly. And so they've got to be hospitalized and monitored. That is a bit on the more severe side. And that is, round the clock care. You're in a hospital wing. A lot of the times, the admitting diagnosis is malnutrition, so that insurance can cover it. Otherwise, insurance doesn't cover it. Insurance.
Yeah.
And then there's treatment facilities. That is also something very different, where you can go to these facilities and be there anywhere from 2 weeks to maybe even a month or more, depending on, your level of the severity of the disorder. But there, it's residential. You live there. They drop you off at some point. You sign yourself in, and you have everything available to you. And everybody who's there is also there for the same time. So it gives you a sense of community. One, you're not alone. All of your healthcare providers are there. So they have dietitians, they have therapists, they have your psychologists, you got psychiatry, and they even have occupational therapists. And some people say, well, why do you need an occupational therapist? Well, because they help with activities that help you just forget about the eating disorder and help you re-engage with society. Because one of the things is when an eating disorder has taken its toll on someone's life, it's everything like that. They live for the eating disorder. They've separated themselves from their friends. And in these treatment facilities, they kind of teach social skills again. They teach you how to engage, and just social skills. They'll have music therapy. They'll have art therapy. They'll do a lot of things that will help the person kind of normalize their life again. And there's active support groups and things like that. And so you can receive, that type of treatment residentially, and that's a different level of care.
Okay. So earlier, when you were discussing like the different providers and just now the different levels of care, I guess how does someone decide like what is the appropriate level of care for that person?
That's a good question. One of the things how that's decided mainly is during the intake process. When you go in and you get help from someone and you get screened and they say, yes, there is an eating disorder, or no, but there is some disordered eating habits that you're showing. What they might do is depending on how severe it is. So depending on, is it affecting other bodily systems? Is it being exacerbated by an existing underlying mental illness? So anxiety, depression, PTSD, something. And then is it to the point where you may need, more precise and round-the-clock medical monitoring? And those factors then determine which treatment pathway you go. Do you go just outpatient, intensive outpatient, residential, or inpatient, and it kind of guides the pathway. So your treatment team will decide that based on your own individualized case. and the acuity of that. If it's lower acuity, something that's just starting, we're catching it early, you may could just do outpatient therapy for a year or two, or however long it takes for you to, come into remission, or it may need something more.
Mm. I know you shared already some things that occur in treatment, like the different types of therapy and the different types of assessments, but are there any other specific treatment modalities or strategies that someone may see when they seek help?
Yes, a lot of what you find is definitely medical treatment. So you may get prescribed medications, very common, majority of people do, because there's always an underlying mental health issue besides the eating disorder. And so they want to make sure they treat that, because if that's exacerbating it, then let's treat that, and then let's see what happens with the disorder. Aside from therapy, you come into therapy and there's individual therapy that happens. There's also group therapy with other people who have the disorder. And they may not have the exact one that you have, but everybody in the room has some type of eating disorder. And so everybody gets together to talk. But most importantly, there's family therapy. And family therapy can be very beneficial, especially with adolescents or younger adults, because it helps everybody understand what the person is going through. It brings to light family dynamics that can be or could have contributed to the disorder, and it helps open communication in families where there might not be open communication. And so all those things are things that happen, and then of course they get paired up to work with a dietitian.
Right.
And that's another way to treat.
Right. Speaking of a dietitian, we're going to switch gears a little bit, but
Sure.
From your perspective, what is kind of the main difference between like a general dietitian and one that's trained specifically in eating disorder care?
That is a really good question. I get that question a lot, especially from my students, because they say, well, can't we treat eating disorders out, when we're done, set up a private practice and do it? I'm like, yeah, you can, but you may not want to.
Yeah.
And here's the thing, to your question, general, every, dietitian, we're all trained the same. So we all get training on a little bit of training on everything. But just like a PCP or an internal medicine doctor, we can see a spectrum of things, right? But sometimes there are things that are out of a scope for a general dietitian to cover. So
Right.
if, something is super specialized like dialysis, they may need to see a renal dietitian specifically for that, right? And so within our own field, there are dozens of specialties within our field. And, a general dietitian can help they can help screen, they can help start the conversation. But it really takes somebody that's trained in eating disorders as a dietitian to truly be able to help the patient and to be able to handle the complexity of the disorder.
Yeah.
Because it's more of a mental disorder than it is a food, nutritional disorder. We mainly treat the nutritional deficiencies and the normalizing of food and things like that. But what it really entails is having a dietitian who isn't just knowledgeable about it, but competent in the treatment of it. And so there are dietitians who are certified eating disorder specialists. And in order to get that credential, it's an additional credential and certification that involves thousands of hours of training and working with people that have eating disorders. You have to pass a test, and then to keep your certification active, you've got to take continuing education in eating disorders every certain number of years. And so that person or that professional is going to be way more qualified to treat an eating disorder than an everyday dietitian. Now, do you have to have the certification? No, not necessarily. There's lots of places that have dietitians who work with eating disorders. They don't have the credential, but the importance there is the experience.
Right.
Even if you don't have the credential, you want somebody if you're going to be treated. Because here's the reality. You may live in a part of Texas or a part of the country where there are no certified dietitians that specialize in eating disorders. So you may have to go to someone who's not certified. But what you want to ask is, have you treated this before?
Right.
What have been the outcomes when patients have worked with you?
Yeah.
And those are perfectly valid questions for someone to ask their healthcare provider.
Absolutely. I mean, I think too, like we see that in the like mental health therapist world, right? Like you want someone that has experienced, if not like specialized, like credentialing or education around like specific things or a little bit more in depth. So I hear that. I see that. I think too of, especially I appreciate the transparency on like, it's not just like something potentially easy. Like you need like extra experience, education around it, especially with something too, like you said, like it can be a lifelong, right? Like disorder for people, especially if it's not caught early. And so it's something too of like, that's going to take a lot more, like just even knowledge and experience, skill set, even around working with that. So I appreciate the transparency you have with your students too.
Yes, because a lot of them think like, oh, I took this class, and I'm like, oh. I did not go into it. I went into it, very early in my career, but that's because I actually had a lot of training during my internship. In eating disorders. I worked, at Texas Children's and Baylor.
Yeah.
I worked in eating disorder clinics. So I already knew what all the modalities were like. So even going into it was a little bit easier for me, even though I wasn't certified, specifically for it. But I like that you brought up the idea that it could be a lifelong thing. The eating disorder may look different in your teens. It may look different in middle adulthood, and then it may look different in later adulthood.
Right.
Right. And so if you've only worked in one part of that, you may not know how to handle the rest of that as it comes down the line. So it's important to, again, ask what they've treated and how comfortable they are treating, the severity of it, and even where you are with it.
Right. Yes. Oh my gosh. So also like take a moment to emphasize to our listeners, like always ask questions. It is okay to ask questions. There are no dumb questions. I guess too, like thinking about, kind of going back to something we talked about earlier, right? Which is around the healing process, the recovery process of it. What does nutritional healing look like in recovery?
I'm gonna steal somebody's catchphrase with that.
Okay.
But it looks like finding freedom from food.
Oof.
It sounds weird to say that, but it looks like normalized eating, right? When we work with our clients, we try to normalize eating and say, hey, this is just food. At the end of the day, it's calories, nutrients, vitamins, minerals that help your body do the things that it needs to do.
Right.
It's not a bad thing. It's not a good thing. It's not a punishment. It's not a reward. It's just food. So nutritional healing looks like finding freedom from all of those distorted thoughts about food, learning how to look at food as food, socializing around food again, because that's one thing that happens to people is they withdraw from socialization because they cannot be around others and then have to explain why they're not eating or have to explain why they're not doing this and that. It's a lot of the reason why people end up isolated when they have a very severe eating disorder. And so it looks like socialization again. We're teaching them how to engage with social events while they have and they're in recovery with their eating disorder. We talk a lot about body image as well and their self-talk. What does that look like today? You woke up today, we may start off a session and say, okay, you woke up today. What'd you think about yourself today? How did you feel? Oh, because a lot of what we do in nutritional counseling is talk about behavior change. And then when we specify that down to eating disorders, we're asking about how are they feeling with their body today? How do you feel with your food today? What choices did you make?
Right.
And then getting them to eat intuitively again. Listen to your body when you're hungry, eat. When you're full, stop eating. If you feel hungry 2 hours later and it's not exactly dinner time, have a snack. It's okay to do that. And then if you're eating dinner, eat your dinner, and if you feel hungry later, then have a snack. If not, then don't eat. So it's normalizing eating patterns.
Right.
And then more than anything, learning to accept that you're gonna fail and that's okay. And you
Mm-hmm.
can get back up and try it again the next day.
Right.
A
Right.
lot of times, one of the things that puts people at risk for disordered eating is perfectionism,
Oof.
extreme perfectionism.
Yeah.
And that can look a lot of different ways, but a lot of our patients struggle with the fact that, oh, I didn't do it right, and the whole world falls apart. And it's no, it's just one day.
Mm-hmm.
Something happened. It's okay. Next
Right.
day, let's try again. Let's see how that goes.
Mm-hmm.
And so we help them do that by checking in with them. Sometimes we'll have them keep logs of things of how they felt when they were eating, just to check and see, are you still attaching emotions? Is
Right.
emotional eating still happening? And then let's talk about why, right?
Mm-hmm.
The other thing that works with, what we work with patients on is we help normalize anything in their lab work that isn't right. So along with doctors, we may recommend certain supplementation, calcium,
Yeah.
vitamin D. We may ask that they supplement other nutrients and vitamins as well, either through food, and if they're still unable to do it through food at that point, then through a supplement. So it's a combination of things that we do, and then we work with them and talk with them a little bit about body image, but we kind of have a strict line there of what falls within our scope to speak about, and then what doesn't fall within our scope. We try to stick to the food and the meal plans, as well as when they're starting off, they may have a meal plan that they're sticking to just to normalize the eating, but
Right.
then at some point we take the meal plan away. Why? Because nobody can eat on a meal plan forever. That's not realistic.
Mm-hmm.
The idea is to have you make food choices that support your nutrition and your autonomy,
Right.
while at the same time liberating you from all of the things that had you kind of chained down when you were active in the eating disorder.
Mm-hmm. Mm-hmm. Okay, kind of switching gears, but we're getting close to the end here. But thinking about someone that it has a loved one that is in recovery, what advice would you give to that person?
Ooh, lots of pieces of advice. But the first one is letting them know that you're there for them. I think that's one of the things that with disordered eating is people feel like they're alone, because it is not a lot of people that have a diagnosable eating disorder or that are actively in treatment, right? For a
Mm-hmm.
variety of reasons, right? And, we talked about that in the first episode, the underdiagnosis, the
Right.
underreporting. But when you know they have one of the best things you can do is just let your family member, friend, loved one know, hey, I'm there for you.
Mm-hmm.
I'm here to listen. And really, I challenge, people, listen to understand. Don't listen to respond. They may
Right.
not need you to respond. They may just need you to listen about how they feel.
Mm-hmm.
To really refrain from placing any kind of judgment on the food that they're eating. You don't know what the treatment plan is. Or
Right.
you may, but, let the person really decide whether they're going to stick to it or not stick to it.
Mm-hmm.
Let them make the choices that they want to make, and be supportive of it. Because a lot of times family members, well-intentioned, may
Yeah.
start asking, well, why aren't you eating that? And the dietitian said this and your doctor said that. And it's like,
Mm-hmm.
no, we all know what they said.
Right.
Let's just support them where they're at.
Yeah.
They may come into the treatment phase of it ready to go, and then they realize, okay, maybe I can't. And there's a lot of self-doubt and things. All we can do is support them. And if you notice that things are getting, worse, maybe they're not improving, or
Mm-hmm.
maybe this is the beginning of it, you're just noticing things where they need to probably seek help.
Yeah.
It's okay to bring up, hey, I've noticed XYZ. Do you think you want to get some help? Or do you think you may need to go back to see your doctor?
Mm-hmm.
And let them decide if that's something they want to do and
Right.
they're able to do. In certain cases where people, it's life-threatening, we may have to make the call for them, but that's
Mm-hmm.
a different conversation, and it's a more,
Yeah.
severe case, right?
Right.
And in that sense, their care team is probably much more involved in checking on them on a day-to-day basis if they're at home, right?
Mm-hmm.
But the main thing is, avoiding any behaviors that exacerbate the eating disorder, body checking,
Yeah.
asking about weight, making it about that. And really try to, one of my favorite things to tell family members when they ask, what can I do? And like, do you know or do you have any idea of what your friend or family member likes to do for fun and brings them joy that has nothing to do with food? Oh, yeah, they like to go to concerts. Yeah, they like to do this. Try doing that. Support them in doing activities that take their mind off of things, that make the focus on something else rather than the eating disorder, and engage in conversations about other things too, because, people's lives change when they have an eating disorder. It affects several systems in their lives.
Right.
And so they may want to talk about other things too.
Yeah. Yeah. No, that's such a good point. I think too I especially appreciated the part that like a lot of times people sometimes in their own anxiety go straight to like solution focus versus like I'm actively sitting here with you and I'm listening and I'm just like present. And I think too, like that's such a thing, even again, in our realm of things that comes up a lot of how can we check our own anxiety to really just show up for the person that like needs us versus going into I need to fix you mode, which is really hard to get out of.
Very hard.
Yeah.
But are there any like kind of red flags for people to watch for just in terms of like I guess kind of keeping an eye on their own relationship with food, body image, things that listeners can kind of keep in mind and start checking?
Yes. One red flag would be any behavior that we would say is compensatory behavior. So behaviors that compensate for something. So if you eat something that you deem is not something you're not supposed to have, and then you're doing something later to make up for it, quote unquote, that's a red flag because that shows that you're feeling some type of guilt about eating something, and therefore you have to do something to fix it. And so a lot of people engage in over-exercising or they restrict or things like that. So if you find yourself doing things like that, saying, oh, I'm going to eat this, but I'm going to have to do this later.
Right.
You don't have to do anything to earn food.
Yeah.
It's just food, right? And that comes as, as we learn that relationship between food and whatnot. But yes, that's one thing. If you catch yourself doing behaviors after you eat or saying that you have to do something to earn food,
Right.
that's kind of a red flag. If you're tracking calories and things like that are kind of the norm now, especially with smartwatches and,
Right.
apps and things like that, people like to track their intake. And that's fine. Some people just want to know where they are and maybe they have fitness goals or health goals they're trying to reach.
Right.
But if you're doing it to the point where it's becoming obsessive, and you begin to restrict and restrict and restrict more, that could be an issue. Another red flag is attaching emotions to food and eating emotionally. If you find yourself doing that several times a week, that would be a red flag that I would ask for help. And that looks different for everybody, but for our listeners, like what might that look like? Well, that may look like, for example, having a bad day at work or having an argument with a partner or having something not go well, in life, and then turning to food as a coping mechanism.
Right.
And then if you find yourself doing that consistently and constantly, that might be a red flag for you to kind of get some help.
And I guess on the other side of that, right, like noticing the red flags, what are some practical everyday things that people can kind of do to start like shifting their relationship with food or their body in general?
I think awareness is the first thing. Is, when you sit down to eat, be aware of your surroundings. Who are you with? What are you talking about? What's happening? Are you eating and paying attention to what you're eating? Are you eating more, quote unquote, mindlessly? So you have a tendency that when we're distracted, watching television, scrolling through our phones, sometimes even in conversation, we may eat more than we would normally eat if we weren't distracted by those things, right? And so, that would be one of those things that I would say that, people could be watchful of is, watch what you're doing when you're eating and, see how things feel. Eat intuitively, right? If you eat something and, you have half of your plate left, there's no obligation to eat it. If you don't want to, ask a to-go box, eat it later, right? Sometimes we want to finish everything on the plate or whatnot. Save it and eat it later is okay. Some other things that people can do is being okay with your body. I think that's a big one. A lot of people, like you were saying earlier, people, well, I want to fit into this dress or this pair of pants or whatever. I want for guys, I want to look like I did. It's like, well, your body has changed. You've undergone stress. You've undergone puberty. You've undergone all these things. Some people have had pregnancies, and yeah, those things change your body, but being okay with the imperfections of your body, because do we all have something we want to change about our body? Of course we do, right? It's just human, it's normal, but not obsessing about it is the key there. It's just acknowledging, yeah, I have this area that I want to work on, but it doesn't consume your whole life, so to speak. And so come to terms with who you are and what your body looks like and be okay with it. There are a lot of people that, while they don't have body dysmorphia and they don't have a diagnosable eating disorder, they have a lot of like insecurities about their body. And sometimes talking to a therapist about those things can catch them from getting further down the line to something that could become an eating disorder. So I'd say if you're struggling with anything to do with body image, just seek some help. Go talk to somebody, a qualified professional. And it is never a bad idea to go see a therapist for the stresses of everyday life. That is what therapy is for. And the idea that you have to figure it all out yourself is a big myth that social media promotes right now. And it's not just social media, but we see like this whole hyper independence thing.
Oh,
that
yeah.
people have a sense of pride over.
Mm-mm.
Doesn't have to necessarily be that way.
Mm-mm.
If you need the help, get the help. There's no problem with it,
Yeah.
And I think that's one of the things we can do ourselves to kind of prevent an eating disorder from happening and have more awareness of our bodies, our sense of eating, our relationship with food, and things that we can do to, mitigate that before it gets to a point where treatment is needed.
Yeah, those are such good points. Thank you for sharing that and like emphasizing it's okay to get help. And that's why we are doing this series, like to provide the help and the resources. So to wrap up this episode, we just want to touch on the things to look forward in the next episode, which is something you hinted at already, the social media influence and like more food focus, like how to like grocery shop or like things to notice to find a healthy balance in your diet. And I'll also answer some questions from our listeners. So be thinking of your questions, listeners, or also bring forth maybe some common questions that you get from your students also. And we can address those there. I know we usually end up with a quote, but like the quote that you said earlier was like, that is the quote for this episode. The finding freedom from food.
Mm-hmm.
Wow. I was like, yeah, literally t-shirt stickers.
Yeah. And there's actually a dietitian on social media. That's her handle. And that's why I said I'm stealing it from somebody else.
Yeah.
But she's an intuitive eating dietitian, former, recovering from an eating disorder herself, and she specializes in treating eating disorders. And I love the saying because that's really what eating disorder treatment with a dietitian is about, is finding the freedom from food and knowing that it's possible.
Yes.
Got to go follow them.
Yes. Well, on that note, thank you so much for joining us for the second episode.
Thank you for having me. Very excited for the next one.
Yes. Thank you.
And thank you, listeners. We will see you next month. Bye.